Hello everyone and welcome to our presentation. Today we'll be discussing chronic obstructive pulmonary disease or COPD. COPD is a chronic respiratory condition. It affects millions of people worldwide and it can greatly impact a person's ability to breathe and do everyday activities. COPD is important to study because it's progressive. It can lead to frequent healthcare use, such as hospitalization, and it has a major impact on quality of life, especially as symptoms become more limiting over time. So in this presentation, we'll explain what COPD is, how it develops, who it affects, and we'll focus on rehabilitation strategies, especially pulmonary rehabilitation that helps a patient manage symptoms and disability associated with COPD. Before we begin, here's a quick overview of what we will cover in this presentation. First, we will define what COPD is and explain why it's considered a chronic disease. Next, we will look at the epidemiology, which include how common COPD is and which population are most affected. Then we'll discuss the pathophysiology, meaning what happens inside the lung during the disease. After that, we'll review signs and symptoms and the complex nature of COPD as a chronic condition. Finally, we focus on rehabilitation strategies, review research evidence, discuss study results at the end with a conclusion and references. So to begin, what exactly is COPD? COPD stands for chronic obstructive pulmonary disease, which is progressive inflammatory lung disease. It causes persistent airflow limitation. In simple terms, this means that airflow into and out of the lung become more restricted. It makes a person have a hard time breathing. COPD is most commonly caused by long-term exposure to things like harmful particles, gases, particularly cigarette smoke. Although environment pollution and occupational exposure can also contribute as well. COPD mainly includes the two conditions, which are chronic bronchitis and emphysema. So chronic bronchitis involves inflammation of the airway and increased mucus production, while emphysema affects the air sac in the lung. So together, these two conditions lead to reduced airflow and breathing difficulties. And the airflow obstruction is not fully reversible. This means disease typically worsens over time. Because of this, COPD is considered a serious chronic respiratory condition that can significantly impact a person's daily life and overall health.
Before diving deeper into the disease itself, it is important to understand why COPD is considered a chronic disease. Chronic diseases are conditions that usually develop slowly over time and tend to last for many years. Unlike acute illnesses that appear suddenly and can often be cured quickly, chronic diseases require ongoing care and long-term management. People living with chronic conditions often need to adjust their lifestyle, follow medical guidance, and continuously monitor their health in order to manage their symptoms and maintain their quality of life. COPD fits the definition because the damage that occurs in the lungs develops gradually and cannot be fully reversed. Over time, the airways and lung tissues become damaged, which makes breathing more difficult. Because this damage is irreversible, treatment does not focus on simply curing the disease, but rather on slowing its progression and helping patients manage their symptoms. Another reason COPD is considered a chronic disease is that it tends to worsen over time. As the condition progresses, breathing can become increasingly difficult, which may affect a person's ability to perform everyday regular activities. This progression means that individuals with COPD often require long-term medical care and ongoing monitoring. COPD also has a significant impact on daily life. Patients may experience limitations in physical activity, changes in their routine, and the need for ongoing symptom management. As a result, many individuals benefit from lifestyle adjustments, medical treatment, and rehabilitation programs that support their overall well-being. Additionally, COPD is typically caused by long-term exposure to harmful irritants, which contributes to the slow development of the disease. Patients may also experience periods where their symptoms suddenly worsen, known as exacerbations, which can affect their health and require medical attention immediately. Now that we understand what COPD is, let's take a closer look at how common the disease exactly is and who it usually affects. According to the Public Health Agency of Canada, more than 2 million Canadians are currently living with COPD. However, the actual number may be even higher because many cases remain undiagnosed. Some individuals may experience symptoms for years without realizing they have COPD, which means the disease can continue progressing before it is properly identified and treated. COPD is most commonly diagnosed in adults over the age of 40, and the prevalence of the disease even increases with their age. As people grow older, the long-term effects of exposure to harmful substances and environmental factors can begin to impact the lung function, making older adults more likely to develop the condition. The disease is also strongly associated with long-term exposure to smoking and air pollutants. Individuals who smoke or who regularly inhale polluted air are at higher risk of COPD because these irritants can damage the lungs over time. Continuous exposure to these substances contributes to the gradual development and worsening of the disease. Research has also shown that COPD is more common in females. In addition, the prevalence tends to be higher among individuals living in lower income communities. These differences may be related to factors such as environmental exposures, access to healthcare, and other social determinants of health. COPD is also one of the leading causes of hospitalization related to chronic illnesses in Canada. The severity of symptoms and the occurrence of exacerbations can often require medical care or even hospital treatment. Because of its high prevalence, its impact on patients' daily lives, and the burden it places on the healthcare system, COPD continues to be an important public health challenge in Canada.
So now that we've looked at how common COPD is, it helps to understand what is actually happening inside the lungs when someone develops this disease. So COPD usually develops after many years of exposure to irritants, most commonly cigarette smoking, although air pollution and other certain occupational exposures can also contribute. These irritants trigger chronic inflammation in the airways, meaning the tissues inside the lungs remain irritated and swollen. As a result, the airways begin to narrow and produce excess mucus, which makes it harder for air to move in and out of the lungs. This process is closely related to chronic bronchitis, one of the conditions that make up COPD, where the airways remain inflamed and produce large amounts of mucus over time. COPD can also involve damage to the alveoli, which are the tiny air sacs responsible for exchanging oxygen and carbon dioxide. This damage is commonly associated with emphysema, where the walls of the air sacs break down and lose their elasticity. When this happens, the lungs lose some of their ability to transfer oxygen efficiently into the bloodstream. Even though a person is still breathing, the body may not receive oxygen as efficiently as it could. So overall, COPD affects both the airways and the air sacs of the lungs, which ultimately leads to reduced airflow and breathing difficulties associated with the disease. Because of these structural changes in both the airways and the air sacs of the lungs, people with COPD begin to experience a range of noticeable symptoms. One of the most common symptoms is shortness of breath, especially during physical activity. This occurs because the lungs are no longer able to move air and oxygen as efficiently as they normally would. Many individuals also develop a chronic cough along with increased mucus production, which is closely related to the airway inflammation and mucus buildup we discussed earlier about chronic bronchitis. Other symptoms may include wheezing, chest tightness, and fatigue, partly because the body has to work harder to maintain normal breathing. As these symptoms continue, they can begin to interfere with daily or everyday activities. Tasks that once seemed simple, such as walking, exercising, or climbing stairs, may become more difficult as lung function declines. In more advanced stages, patients may also experience exacerbations, which are sudden flare-ups where symptoms become significantly worse. These episodes often require medical treatment and are a common reason for hospitalization in people living with COPD. Overall, the symptoms of COPD reflect the physical changes occurring in the lungs and can gradually impact a person's ability to carry out normal daily activities.
At this point, you might be wondering why COPD is considered such a complex disease. One reason that COPD often involves multiple overlapping processes, mainly chronic bronchitis and emphysema, which affects the lungs in different but connected ways. Patients can also have very different symptom patterns and progression depending on the extent and location of lung damage. Another reason COPD is complex is because it frequently occurs alongside other chronic conditions such as cardiovascular disease, osteoporosis, and mental health concerns like anxiety and depression. These combinations can worsen functional limitations, complicate treatment decisions, and increase the overall burden on the patient. Because of this complexity, COPD management usually requires a multidisciplinary approach combining medical treatment with rehabilitation, education, and long-term self-management strategies.
So now that we understand the disease itself, the next question becomes how can chronic obstructive pulmonary disease be managed and treated? One of the most effective approaches for treatment and management is pulmonary rehabilitation. Now, pulmonary rehabilitation is a structured program designed to help people with chronic lung diseases improve their physical function and overall quality of life long term. Unlike passive treatments where patients simply receive medication, pulmonary rehabilitation is considered active care because patients are directly involved in improving their own health through guided interventions. These programs typically include supervised exercise training, breathing techniques, education about managing symptoms, nutritional counseling, and lifestyle supports such as smoking cessation guidance if needed. The goal is not to cure COPD since it's a progressive disease, but to help patients gain better control over their symptoms and maintain independence for as long as possible. Pulmonary rehabilitation programs are usually led by healthcare professionals such as physiotherapists, respiratory therapists, and physicians who work together to support patients. Pulmonary rehabilitation has been shown to provide several important benefits for patients with COPD. One major benefit is improved exercise capacity, meaning patients could perform physical activities such as walking, climbing stairs, or completing daily tasks with much less difficulty. Furthermore, exercise training strengthens both the respiratory muscles and the skeletal muscles used for everyday movement. As these muscles become more efficient, the body requires less oxygen during activity, which helps reduce the problematic sensation of breathlessness. But it doesn't end there. In addition, pulmonary rehabilitation has been shown to improve quality of life, reduce anxiety related to breathing difficulties, and even decrease hospital admissions related to COPD flare ups. This not only improves patient outcomes, but also reduces the burden of the healthcare system or on the healthcare system. Overall, pulmonary rehabilitation plays a critical role in helping individuals with COPD live more active, independent, and fulfilling lives despite their conditions.
So, for the research evidence, because pulmonary rehabilitation is widely used in clinical practice, researchers have looked closely at how effective these programs actually are for people living with COPD. One important study was conducted by Zhang and his colleagues in 2022. In this study, the researchers performed what is called a systematic review and meta-analysis, where they analyzed results from several randomized controlled trials that evaluated pulmonary rehabilitation programs for patients living with COPD. The goal of the study was to determine whether pulmonary rehabilitation could help improve exercise capacity, reduce symptoms like shortness of breath, and improve a patient's overall quality of life. By combining data from multiple clinical trials, the researchers were able to provide stronger and more reliable evidence about how well pulmonary rehabilitation programs works for people living with COPD.
The results of the study showed that pulmonary rehabilitation significantly improved exercise capacity and the quality of life for individuals with COPD. Overall, patients in rehabilitation programs were better able to tolerate the physical activity and experience less breathlessness during daily activities. However, there were also limitations. Even though the meta-analysis combined with randomized trials, the included studies did not all use the same exact program structure. For example, rehabilitation programs differed in length, intensity, and specific components included, which introduces variability in the results. Additionally, some of the included trials had relatively small sample sizes. Smaller studies can reduce precision and may not represent all COPD populations equally. Due to these factors, pulmonary rehabilitation is clearly effective overall. However, outcomes may vary depending on the program's design, setting, and patient's characteristic.
To conclude, COPD is a progressive chronic lung disease that significantly affects breathing and daily functioning. It is considered complex because it involves multiple lung changes, varies between patients, and is often accompanied by other chronic health conditions that increase disability and complicate management. Although COPD cannot currently be cured, rehabilitation strategies, particularly pulmonary rehabilitation, play a critical role in improving functional ability, reducing symptoms such as breathlessness, and enhancing quality of life. Overall, understanding both the biological mechanisms of COPD and evidence-based rehabilitation approaches is essential for improving patient outcomes and reducing the overall burden of this disease on individuals and the healthcare system. Okay, thank you so much for listening to our presentation. And these are the academic and public health sources that we use to support the information that was presented in the slides. Thank you.